Welcome. This is the East Bay Leadership Council's Opportunity Task Force. We're going to concentrate on a conversation around collaborations in healthcare today. We're going to do so partially, I think, to try to bring a little positivity and to celebrate some of the positive that came out of the last year and a half. We know it's been incredibly difficult, and we've tried to concentrate some of our meetings on really looking at vaccine science and talking about how to meet the need. But we wanted to have a meeting that also said, well, some really positive things came out of this, and just to highlight some encouraging stories. So Debbie and Rebecca are both here to tell us a little bit about that, or just share with us some of what they've observed. And Cindy's going to chime in as well and share a little bit from her perspective. So our hope is that this will be a pretty conversational meeting. It is our last meeting before we take a 2-month break. We're not going to meet in July and August, partially because there's just so many vacations planned for this particular summer. But we're excited to get back in September, and towards the end of our meeting today, I hope we'll have a few minutes to just hear if anyone has some ideas that they'd like to put forward. In the meantime, we will continue to send out through our weekly newsletter information about bills that we've been tracking, some information about the budget as that continues to go forward. So we'll continue to monitor things and send information out. And if there's anything super specific to this group, I'll be sure to send it to all of you by email. But if not, we'll meet again in September. And in the meantime, I just wanted to say thank you so much to the planning team and leadership team who's been really helpful in getting the Opportunity Task Force off the ground this year. This has been our pilot year. So thank you to Cindy and Elaine, who both of them are here. Brian was unable to join us, but he's also a part of our team, and really wanted to acknowledge that. And Sheila is considering possibly being part of our leadership team too. So thank you to all of you who kind of come together and put these thoughts on paper and help us to put them into action. If anyone is interested in that, please feel free to email me, and we're always looking to expand and to think about who's going to kind of come up next as we build out the EBLC leadership structure. The last thing I wanted to mention is just that we do have an event on Monday. If anyone is interested, with Assemblywoman Bauer Cahan, she's going to come talk to us about her legislative package this year. So if that's something of interest, I'm going to put the link to it in the chat. If you're a member of the East Bay Leadership Council, it's free, and we'd love for you to join us and share with her possibly some of your thoughts on what you'd like to see her concentrate on the rest of this year and possibly next year. As we all know, they start to build those legislative packets pretty much in the fall. So we're not all that far off from when she's probably starting to think about next year and or following some 2-year bills. So that's a quick update. As for today, we're going to hand it over to Debbie in a minute to have her kind of share with us. And then Rebecca and Cindy, you'll both share afterwards. And then we're just going to actually open it up to member updates. I'm going to give a little bit of an update about what's been going on in EBLC and some of the bills that we've talked about here at the Opportunity Task Force, what's been happening with them. But other than that, mostly hoping it'll be a pretty conversational meeting, and really appreciate those of you who were able to join us. One of the things that we haven't been doing as much over Zoom, but we do have time for today if everyone's open to it, is to just actually have a quick introduction. Just let everybody kind of say hello and what organization they're from, and perhaps share a positive thought. Bob, if you're comfortable with it, I would be happy to just kind of call on people, since we all are going to have slightly different squares. Does that work for you?
Sure.
Okay, awesome. Thanks, Bob. So Barbara, do you want to start us off?
Oh, okay. So I guess it's not so recently elected, but I now am serving again on the Central SAM Board. And I also chaired the Managed Care Commission. And yeah, I do some other things too, but that I think probably takes a lot of my time. And I teach for Cal State East Bay. And I'm looking forward to August 18th when we start back up again.
Thanks, Barbara. Okay, the next person is Rebecca.
Hi, good afternoon. It's great to see you all again, if still virtually, but probably in person very soon, I'm thinking. I'm Rebecca Rozen with the Hospital Council, and I am a former co-chair of the Health Task Force, which preceded the Opportunity Task Force.
Thanks, Rebecca. Roy?
Hi, I'm Roy Hodgkinson. I'm with the Orinda Chamber of Commerce, and I'm also a counselor with East Bay SCORE out of Alameda. College of Alameda actually is where our office is now when it opens again, and covering Alameda, Contra Costa, and Solano counties, helping entrepreneurs realize their dreams and support them in getting going. Also am on the board of an organization called SUR, which is a weekday recreation for mature men. And we have 11,000 members across Northern and Central California. And we're very interested in the current health protocols and trying to inform our members.
Well, thank you for being here, Roy. Stephanie Rivera, you're next on my screen.
Hi, everyone. I am Stephanie Rivera. I'm the Director for Community Health Improvement at John Muir Health. And with COVID, I'm actually a bit redeployed to the Public Health Institute as their Executive Director for California Contact Tracing Strategic Initiatives for the state of California. So I hope to be back full-time at John Muir Health in the next Q4. And yeah. And was there another question?
No, just
Yeah,
grateful.
can you say that again? What was your deployment? I'm sorry. I was like furiously writing. What was it?
Thank you.
I guess she was going to repeat it because I could barely hear you too.
Oh, you can hear me? Usually I'm yelling and screaming. Okay. So I'm with John Muir Health, Director of Community Health Improvement. When COVID hit, I was asked to oversee a large Public Health Institute program with the California Contact Tracing Strategic Initiative. And it was for contact tracing and vaccine support now in vulnerable populations throughout the state of California. So my hope is to come back to John Muir, if they'll have me. And I'm here, like, I have like 10 to 20% FTE at John Muir Health, so I still oversee the programs. And it looks like I'll be coming back probably in August or September. And September, when we all start to see each other again. So
Perfect timing. It'll be a coming home ceremony for you as well, Stephanie.
Yeah.
Cindy, you're next on my screen.
I'm Cindy Hatton, President and CEO of Hospice of the East Bay.
Thanks, Cindy. Elaine, you are next.
Hey everyone, I'm CEO of Visit Concord, which is the Tourism Improvement District Agency for Concord. So we've had quite a year in hospitality, but now we are having all kinds of people come out to me on when can they do events and how can they get together. So it's a fun time, and we also now officially opened the Concord Visitor Center. So we have lots of great partners that are coming back to us and ready to put out all their things and tell us all about the things there are in the whole Mount Diablo region. So exciting.
I can't imagine how busy you've been, Elaine. Debbie, you're next.
I'm Debble Toth, the President and CEO of Choice in Aging, and a lot of other things, but I will talk a little bit about some of that in just a moment.
Patience.
Hi, I'm Patience Ofodu, Interim Executive Director for the Workforce Development Board and Business Services Manager. So wearing two hats, hopefully going back to my Business Services Manager position soon, which I love, so I could spend more time with you. So here for you, and my board member Stephanie is right here. So I thank you, and I thank you all for the great work you do. Thank you.
Thank you, Patience. Rob, you're next on my screen. Oh, Rob, we can't hear you. You're unmuted, but we'll come back to you, okay? We'll let you kind of figure out. I think it might be your headphones. Anne-Marie, you're next.
Hi, Anne-Marie Taylor. I'm a backup for John Muir Health. I decided that I wanted to jump on board just because the topic is so interesting. But I work here in the foundation. I'm a collaborative team member with Stephanie. We definitely want her back as soon as possible. But I was just going to say that it's been a roller coaster ride. It's been extremely difficult at the hospital. And yet at the same time, we just had a meeting this morning, our leadership huddle, and they shared about how incredibly accelerated the collaborative work has been in terms of lab testing, communication. I mean, so many things that we could never think would happen this quickly and this well. People rose to the occasion, and we're very proud about that and very honored to have been part of it. So that's us.
Thanks, Henry. Mariana, you're next.
Hey all, it's been a while. Great to be back with you. Mariana Moore. I'm the Senior Director for the Ensuring Opportunity Campaign, which is a countywide initiative focusing on ending poverty in the county. Modest goal. And I'm at a lot of different tables. I'm currently chairing the Measure X Community Advisory Board. On the healthcare side, I work with the One Contra Casa Coalition and with Healthy Richmond's Access to Quality Healthcare Coalition to ensure both the state and the county level that all residents, regardless of anything really, including immigration status, have access to full scope medical care. So big focus at the moment. Great to be here. Thanks.
Grateful to have you here. And we're really excited to have Sarah here because she's a new face. Hi, Sarah.
Hi, everyone. My name is Sarah Chodakewitz. I'm rounding out the John Muir Health team today. I'm the new Director of Government and Community Affairs.
So excited to have you here. Sheila, would you like to go next?
Sure, I finished my yogurt so I can talk now. Thank you. I'm Sheila Hassell Hughes. I'm the Dean of the School of Liberal Arts at St. Mary's College in Moraga. And you asked us, Lindy, for something positive. So I will say that we expect pretty much all of our staff to be back on campus on August 3rd. And although we're starting to trickle back now, and we'll be almost entirely in-person classes in the fall, except for programs that have strategic online presence and a few classes to accommodate students who need them for medical reasons, but a very small number.
That is exciting. And Daniel, Mr. Petticord, you are next. Welcome. It's nice to see you.
Hi, so wonderful to see all of your friendly faces again. I've missed this group very much. Sorry for joining you late. Dan Petticord, I'm the Public Health Director for the county. And I just want to echo my thanks and appreciation for the colleagues from John Muir. No other health organization stood taller and longer than did you in helping us address this COVID-19 pandemic, which we're slowly working our way out of and almost there, but still have a few miles ahead of us yet. And just we want to thank you for your endurance through all of that so much.
Well, and that thanks sets an excellent tone for our topic today around collaboration. So thanks to you for that. Satinder, you're next. Would you like to say hello?
Yes, hello, good afternoon, everyone. Satinder Malhi, Associate Director for Government Community Relations, Cal State East Bay. And as you can see, I'm in the office without a mask. And this fall, we look forward to welcoming back many of our faculty, staff, and students as well. So good to be here. Thank you.
That's exciting. Thank you for being here. Audrey, you don't have your video on, but if you're here, please feel free to chime in and say hello. Oh, hi, Audrey.
Everyone, Audrey Momo, she, her, Senator Nancy Skinner's district director, and I'm really looking forward to hearing all of the updates.
And we're excited to have your new face here too. So welcome and thank you for joining us. Okay, Catalina, you were also on your phone, but would you like to just jump in and say hi quickly?
Yes, hi everyone, Carolina Herrera, Community and Government Relations for Kaiser Permanente, and we're excited to be here, and I'm just restarting my computer, so I hope to log on video in a second.
Wonderful. Well, what an amazing group. I'm so excited to have all of you here. And without further ado, I'm going to hand it over to Debbie. And we didn't ask anyone to prepare any presentations. Again, wanted it to be somewhat conversational and just to kind of hear about some of their reflections over the last year and a half and how collaboration has really played a role in some of our successes. So Debbie, it's all you.
So Lindy, could I introduce myself?
Oh, I'm so sorry, Bob. I said hello and thank you to the whole planning group, and I didn't even recognize our leader here. Please, Bob, do.
That's all right. I'm sure your review will come up soon.
Oh, no.
Anyway, good afternoon, everyone. I'm Bob Linscheid. In my day job, I'm president and CEO of the Walnut Creek Chamber of Commerce and Visitor Bureau, and passionately involved in EBLC on the executive committee. In the past, have chaired the Talent and Education Group, and pleased to be part of the Opportunity Task Force, which obviously is economic development, healthcare, and also talent and workforce. And excited for the opportunity here, and looking forward to hearing more about the healthcare initiatives going on, and we'll have the opportunity also to talk about the great work that Kaiser and John Muir are doing with getanswerscontracosta.org, which we'll talk about later on the agenda. So thanks everybody for being here today. And Lindy, back to you.
Thank you so much, Bob. We so appreciate you. I appreciate you. Go ahead, Debbie. It's all yours.
All right. So first, I apologize in advance. I'm going to have to hop off after I do mine because I'm doing another presentation. But I did prepare a couple slides, but not that you need to look at them. But what is choice in aging? So we've been members of the East Bay Leadership Council since it was the Contra Costa Council, and I too was a co-chair with Rebecca of the Healthcare Task Force before we reorganized the organization. But the Choice in Aging is a nonprofit organization situated in Pleasant Hill, but we have a site in Antioch as well, and we serve Contra Costa, Solano, Napa, and Sacramento counties. But the vast majority of work we do is here in Contra Costa. And our whole mission, we're a nonprofit organization, and we've been around for 72 years, is to support people living independently with dignity in the community so that they can learn and grow and age as part of a community. And we do adult day healthcare, we do complex case management, we do transitions out of skilled nursing and back into the community. We do all of these things predominantly for low income populations and refugee immigrant populations. And we sort of work in our own little silos, right? Although we have connections to Meals on Wheels and Ombudsman, but it's sort of like that's our place in space. When this pandemic hit, there were two things I would say that happened. One was panic for me on my part when I'm watching that it's all of the people that I love and live to serve that are dying from it. So there was like this sense of severe panic. And then there was this almost immediately following a comfort in seeing this county and public health leading this charge in the most robust response to this pandemic. And so we had always operated over here and the county had always operated over there. And what happened was this. So I would say that in the first week when we started the shelter in place conversations, I was yelling in every single Zoom room and every single webinar and every single phone call, conference call, whatever, like, we have 168,000 seniors in Contra Costa County, and maybe 20% of them are being served by the county or nonprofit organizations, but who's touching or talking to all the rest of them? And anybody who would listen to me was hearing my cry, and eventually got tired of it and started putting me in these different places because the county, when Stephanie was talking about being deployed, the county redeployed I don't know, all of their workforce into what they had already had planned as an operation, as a response to emergency. I don't think it was intended to be a year-long response to an emergency. I think it was more like, what do we do if there's an earthquake or a fire or whatever? But at any rate, I got plugged into a number of different task forces. And the task forces, the first one was the Proactive Outreach Task Force. It met daily at 8 a.m. And there was a data scientist who created a COVID risk algorithm that they applied to all of the 20,000 lives that they were serving or had been touched the healthcare system at the county, and came up with the 7,000 people at greatest risk and started putting a plan together to reach out to them, getting the Automobile Association to make calls, getting Rotary volunteer groups who had been trained as CNAs to make calls, getting County Connection plugged in to get the food bank to give them food to drive it to the homes. Like there was this whole thing that happened from me being what I felt like was a town crier. And what I wanted to share about that was the town crier part of it. When I started talking about people aren't going to be able to get food, seniors don't use online ordering of food deliveries, and like this is not going to come to them, it's got to be phone calls, we got to think about their terms, their needs. It was absolutely fantastic, phenomenal, amazing, outstanding, and we became partners in this process. That task force ended up evolving into looking at vulnerable, historically marginalized populations and those vulnerable. So not just the seniors and people with disabilities, but also people who are people of color, people who are Black, people who are living in those low healthy place index zip codes and how do we target messaging? How do we deliver services? Like this county did such amazing stuff. I also then got put in a daily meeting of the Congregate Living Spread Prevention and Containment Task Force, because this county was really great at long names of task forces. And we met daily. And that team actually came up with a playbook for how to manage not getting COVID in, and if COVID was in, how do we separate our facilities into red, yellow, and green? We have over 400 licensed living facilities for elders between skilled nursing facilities and assisted living residential care facilities in Contra Costa County. And the county health brought in me from Choice and Aging, like they would have never done that in a non-pandemic time. And I was like, we need to have ombudsman in here. They were like, who's ombudsman? Like, so we all got to know each other. We were in these rooms every day. We started working together and we were able to do education in facilities as a group, as a whole. We got them into Zoom rooms. We had doctors at our disposal. We had nurse educators at our disposal. And we started to develop relationships with all of these different entities in the community. And we created what is truly a community. There's nobody I can't pick up the phone and call now. We deployed over 100 volunteers during this time to deliver pulse oximeters, to deliver masks. We did PPE distributions. Like we did it as if we were working for the same organization. We got funding from John Muir. We got funding from the from the regional coalition, the Contra Costa Health Services, whatever it was called. Sorry, I'm screwing up the name of the foundation, but like money, we said, we found a need, somebody died, they died because their oxygen level dropped, nobody could measure it. So we need pulse oximeters. We need 375 of them. We got $10,000. We printed out the instructions, we laminated them. We got 47 volunteers and we distributed them to 365 locations in 1 week. Like we did amazing things together. And I will say we are acting as one. We are a community. The big deal now is to not lose those relationships that we built during this time. And I just want to say, and I'm glad Dan's on, I took the work that was happening in Contra Costa County as a stakeholder advisory committee member to the master plan for aging process. We actually got deployed as the stakeholder advisory committee to advise Health and Human Services on issues in the pandemic related to older adults and disabled people. And I took what was happening in Contra Costa and elevated it into those meetings with the governor, with the Health and Human Services secretary, and they used that to disseminate practices through Department of Public Health, Social Services, Department of Healthcare Services, Department of Aging. Like Contra Costa was the model, and public health led the way. And our challenge is to keep this relationship going. And that's all I'll say. Thank you.
Thank you, Debbie. I think that was really inspiring. And it sounds like there was a lot that came out of this that was positive. I'm just curious, is that effort ongoing? Like, is there an effort to try to make sure these relationships do stay? Is there kind of a task force or?
Well, I can tell you that Debbie has not been silent about that. So one of the other committees that I got on with Rebecca was the Ethical and Equitable Vaccine Allocation Committee. And certainly I have said that in every opportunity in that meeting, like we can't let this go. We have to continue to recognize that equity is about Black people, it's about brown people, it's about indigenous people, it's about refugees, it's about people who are not documented, it's about people who are elders, it's about people who are disabled. Like there are all these folks that we see, and we can't let that go, and we can't let the partnership end. So we have been talking regularly to he's Gilberto, I think, the equity officer, county's equity officer, about how this work continues. And I don't know what the format's going to look like, but they have been convening us regularly on a monthly basis to keep the conversation happening. I don't know that it's been institutionalized in systems yet, but I certainly believe that that's the direction that we're heading. And I feel like we're being heard, but I don't know how it operationalizes. But I can tell you, I pick up the phone and I call Dr. Levin, Deputy Public Health Officer. I have a question about X. She answers my question. I can immediately put a practice into place at work that never would have been happening before. Like we have built truly a seamless community. We recognize that we're all part of it and we're all in this to help one another and lift each other up. It's really, if one of us is not okay, all of us are not okay. That has completely just taken shape for us. It's been amazing.
That's wonderful. Did anyone else have any questions for Debbie?
I just have a comment for Debbie. I appreciate you and all the work that you're doing. And I think one of the things that I hope we don't lose sight of that you mentioned is that communities who typically have not had a voice after the George Floyd incident. And I think it would be a shame for us to not continue to hear that voice. And you know, the social justice movement, for whatever anybody thinks about it, provided a voice for women, for people of color, for those who are disenfranchised, and in a way that I think needed to be heard. And I think Contra Costa County did an incredible job collectively to be able to address some of that, and not everything. So I really hope that that collectively we're still able to work together to figure out how we can address some of those issues that were brought to the table.
Amen.
All right, well, thank you all so much. If you do have more questions, Debbie will be here for a few more minutes, so put them in the chat, but then she's got to head out. So thanks so much for being here, Debbie. Rebecca, did you want to chime in and tell us a little bit about your observations and some collaborations that the hospitals were able to do?
I'd be happy to. And of course, there are lots of our hospitals here today. So I invite them to share because they probably have stories and collaborations I'm not aware of. So I wish I could say I know all, but I don't.
You know a lot.
I know, I'd like to think so. But just from a very high level, I want to echo what Debbie said about the collaboration with the county. I think first and foremost, it has been truly incredible all around. And our experience has been more on the healthcare delivery side because, of course, we're hospitals, so we're in the business of caring and treating patients. And our collaboration has, at least in the very beginning of the pandemic, really focused on safe workplaces for our employees and our physicians and for everyone who is in the hospital, and of course, treating patients with COVID. And it's hard to, you have to kind of go back and remember when all of this happened, February, March of 2020, we didn't even really know how to treat COVID. It was a big guessing game. And so there was collaboration happening amongst all of the medical community around information sharing and best practices. That was tremendous. And that was happening within Contra Costa County, but also within the East Bay, the wider Bay Area. And quite frankly, it extended around the world. So I think there's that piece of it. And then here in Contra Costa County with the health department, I mean, I remember back in February, March, having conversations with county health and our county health officers, and just starting to have the initial conversations and guidance associated with, how do we manage our workplaces, and should we be shutting down entrances, and should we be doing screening, and all of these things that mask wearing, social distancing. These were all concepts that were put in place, pretty early on, but with input from a lot of the hospitals and a bit of a guessing game at the time, all of which, we really needed was very, very helpful to have the county be out in front and having the health officers be that standard bearer for those all of that. So that was incredibly helpful. Debbie's talked about all the work with our seniors and our long-term care facilities in the beginning of the pandemic was where we were seeing the infections and the deaths, and it was horrific for a long time. And one of the first outbreaks in a long-term care facility occurred around that early February, March timeframe, actually in Orinda, and we actually had nurses from John Muir Health actually go in the middle of the night and take care of patients because they had unfortunately had staff who became overwhelmed and didn't know what to do. And that led to another task force. There were many that I know Contra Costa Health Services convened, but there was also a long-term care task force with hospitals, because hospitals have relationships with skilled nursing facilities, because of course when patients are completed their course of treatment in a hospital, if they need further care, many of them are transferred to skilled nursing facilities and other. And so we have a lot of relationships with them. So using those relationships, the hospitals actually went in and trained healthcare personnel in long-term care facilities on infection control practices. We helped them learn how to actually don and doff PPE, which many didn't know. We set up a program for fit testing. So if you wear an N95 mask, there is a process for that, which some skilled nursing facilities hadn't completed or done. And then when we got later in the pandemic and it was time to vaccinate, we actually had teams of Contra Costa County health nurses who went into some facilities, some Kaiser and John Muir teams that went into some skilled nursing facilities and other long-term care facilities to vaccinate personnel, because they were the healthcare personnel were our first goal in terms of vaccination back in December. So there are probably far more forms of collaboration than even I'm aware of. I know just from our hospital leaders' perspective, we do have always had relationships with the county, but I don't think we talked as often as we have been in the last year. And actually up until about a month ago, we're continuing to meet on a monthly basis. At the height of the pandemic, we were meeting once a week, sometimes more than that. Really just to share notes, understand what was happening in all of our facilities, making sure that no one hospital was overrun. Everyone had the staffing they needed, the PPE they needed, on and on. And the county was really the glue to a lot to that. And we were all there to support. So we practice and we have plans for, emergency preparedness. Pandemics is one of those quote unquote plans we have. I don't know that any of us expected to exercise it, and we've learned a ton for sure. But so we had sort of a starting place, but I think we were quickly learning on the fly. And I don't know, Stephanie or Carolina or Sarah or anyone would like to add anything?
I just wanted to add about the mobile clinics. So we have a John Muir Health mobile clinic as part of our community benefit. And Gilbert and Dr. Levin reached out and they were swamped with the congregate living areas that they needed to go out and use their mobile units for that. So we actually partnered with the county and began to provide mobile clinics, vaccine mobile clinics throughout Contra Costa County and East County, Central County, West County, to just offset and augment. And we had our physicians volunteer and our support staff came out, and we vaccinated over, I think it was almost 4,000 Contra Costa people on just Saturdays, and half a day Wednesday for a few months. And it brought people together. And sometimes when you see the data and their numbers, but I think what was important is that I remember the first vaccine clinic we had, an African-American woman with her children and grandchildren in her car came, and I remember the little 7-year-old little girl jumps out of the car because it was drive-through. Everyone had to stay in their car. And of course, if you tell a 7-year-old stay in the car, what's the first thing they're going to do is get out of the car. And she ran to the physician that was giving grandma the injection and said, "Thank you so much for saving my grandma." And I always will visually remember and hear that voice because that's what it was about. And so we did that and partnered, and, you know, Dan, you and Gilbert been a wonderful, wonderful partner in all of this. I know that my little team was exhausted, but we continue to do this. We started seeing patients again, but who knew that the mobile clinics would become such a lifesaver? We were out in Byron, which they were so appreciative of the care that they received there. One of the things we learned from a marketing perspective is that, and I think we all knew this, but we had a lot of people, especially in East County, that couldn't read or write in any language. And we realized that when we handed them the consent form and they would look at it, they would have this look, and our volunteers were so in touch that I remember us going to Byron, and one of our volunteers went to the laundromat, she went to the store, she went to the barber shop, the nail salon, and then she would have gone to the bar, but apparently the bar in Byron was closed at the time. And we got like over 50 people on that day from just doing that. And so I just, you know, appreciate the partnership and the collaboration. I hope we don't lose sight of that.
I want to thank you for that, Stephanie. You know, the partnerships with Kaiser and John Muir were just instrumental to getting our community vaccinated. And, you know, just my humble thanks to both organizations for stepping up big and, you know, leading and co-leading with the county on the mass vaccination clinics, the mobile clinics, the community focus clinics, and as well as all of the different patients and community members you vaccinated within your own organizations. And as I reflect on this and our continued struggle to get what I'll sort of call for the moment the mom and pop doc shops out there are really struggling still to find their place in the vaccination effort. And it really has fallen on the shoulders of these organizations, the John Muirs, the Kaisers, the Sutters, the county health organizations of the world to really do the big lift for their communities. And I'm just so very grateful for that. You know, Lifelong and Clinical, we're also gigantic partners and will continue to be, but you know, our battle isn't quite over yet. And I just want to remind folks that we have neighbors, excuse me, particularly to the south of us in Mexico and Latin America that are relatively unvaccinated. I think Mexico is at about 12% fully vaccinated. I saw a statistic that said folks in Guatemala and Honduras are only at 1% fully vaccinated. And so, you know, the effort needs to be sustained and continued. And my hope is that the United States, as we've now achieved a fairly high level of community immunity and will continue to nip away at even higher and higher levels, that we can begin to deploy some of our resources to help our neighbors to the south, because they desperately need our help. And this is a global public health issue. It isn't just any one local community or any one nation. We're really that's why they call it a pandemic, right? So we're in this together for the long haul. And I just want to just echo that maintaining these partnerships are just so essential, not just for COVID, for all the wide variety of health and social issues that we're going to tackle going into the future.
Thank you all for chiming in. Barbara has her hand raised. Did you want to ask something, Barbara?
Well, I just wanted to share that my clinical group this last semester got really lucky in that we were able to work with the county, and they did COVID testing at 5 clinic sites throughout the county and got to learn on and off PPE. And actually, do you know what? It was the only class that had rated this course with such high marks. And it's because the county had open arms and my students felt very welcomed. And it was an incredible opportunity for them to not only learn, but to share. So thank you, Dan, and thank you to the public health nursing staff.
Well, I'll just echo, it got so bad for a while that this old nurse here was considering volunteering to actually go out and vaccinate. And, you know, it was kind of a scary proposition. I think I'm the last person in the world you want me to put a vaccine in your arm, because it's been about 35 years since I've done something like that.
Yes, I know the feeling. And so my students come back in August August 18th, so maybe we can help it
Yeah,
at another semester.
But we were literally on that precipice. We had pulled literally every nurse and nurse manager available across our entire division and deployed them to the vaccination effort, as did many other divisions and health services. We were woefully depleted of our nursing line staff and leadership. And you know, many other organizations went through the throes of that as well. And I just want to acknowledge the impacts that it had on all of us collectively, and continues to have to some extent.
Correct.
But if we had not done that, we would not be where we are today with the grand reopening of our lives to some sense of normalcy. And that really is due to the collective effort and the collaborations here. So a huge, huge thank you.
Yeah, it was awesome.
Wonderful. Well, thank you all for sharing. And Cindy, I just wanted to pass it to you in case you had anything you wanted to add about your experience.
I think for us, you know, we saw, you know, for us, we saw a surge in patients. We certainly, like many places, struggled with staffing, having, you know, our staff who had to stay at home with kids and trying to figure out, being very creative on how we can, you know, keep people working. We also partnered with John Muir in December, I think it was November, December, when the big surge came and the ICUs were getting so full. We partnered with them on our Bruns house to be able to take patients from the hospital into our Bruns house. And they didn't necessarily have to be hospice patients or palliative patients. So we probably ended up with about, not a lot, but I would say probably about 5, 6 patients we ended up taking. So that was good. We were able to help out in that way. And then just for us, I think for our particular staff, we certainly were the lifeline for families to connect with their loved ones in the skilled nursing facilities, because you know, Rebecca talked about some of the, you know, issues that they had to overcome. And, you know, they just locked down and were so afraid to let anyone in their buildings. And so we shared PPE with them. We were able to convince them that our staff were, you know, full PPE, and they knew, you know, we weren't going to bring anything into the facility. And we were able to be those lifelines, you know, holding phones and talking to families so that we could connect them to their loved ones, you know, at certainly a vulnerable time. And then the other piece of it is for us is, you know, certainly our bereavement services. We've seen a lot more community. We offer bereavement services to anybody in the community. And we have virtual. We had to shift quickly from in-person to virtual. But what we have found with the virtual is it's actually, you know, there's always those silver linings. Some of our frail elderly cannot get to a meeting. They don't drive. We don't want them to be driving. And so they are technology, you know, some of them have gotten pretty savvy. And we also have volunteers that'll go out and help teach them, you know, how to connect. And, you know, they're connecting virtually on our bereavement services. And one of the things this morning I had a meeting and our bereavement manager was saying is that when we have families that, you know, or live across the country or anywhere across the world, now they can connect with our bereavement services. So they can keep in contact with our staff and we can support them wherever they are. And I think, Barbara, didn't we have some of your students too? I think we were able to arrange for some of your students.
You did I think it was the prior semester.
Yeah.
But yeah, you know, I believe in sharing.
Yes, yes.
Clinical opportunities are difficult to come by.
I know. And our staff was like, we can't have students. We've got all this. I said, we need to get these nurses through school. We've got to get them going. So yeah. I think the whole community, I mean, I'm so proud of what Contra Costa County has done. You know, I've seen some of the work in other counties and, you know, I think the collaboration and Dan, you know, certainly kudos to your staff and John Muir and Kaiser, you know, it was an amazing effort. And so I hope we don't lose those.
Thank you, Cindy. Roy, I noticed you had your hand raised. Did you have a question for Cindy?
Well, I wanted to provide a little commentary on some of the experiences we had as a geriatric community. We have 12,000 members, and median age 77, all men. Middle of 2019, we started an initiative to do some health studies with the research branch of UCSF Geriatric Services. And I know Kaiser and John Muir Health both have very strong research activities as well. And this is really about what lessons do we learn from the experiences we've had during this pandemic, and how do we solidify an informal structure of government, private, and nonprofit organizations that came together during the pandemic to accomplish all that was accomplished and preserve that so it's ready for the next time. And part of that is that from our perspective, it would have been wonderful if our organization was known to the people who are trying to run both therapeutic and preventative trials through the CDC, so that we could contribute our geriatric members to the trials. And of course, probably nobody knew to get in touch with us. So, you know, it's an example where you need to have that partnership ecosystem, and you can use it in many ways. And it's about sharing that knowledge and having a playbook for the next time.
That makes sense. Thank you, Roy. Appreciate that. Rebecca, go ahead.
Oh, I was just thinking what pondering what Roy was saying, and I totally agree. And I think certainly there were groups around the table in various places where I was at that I had never met before and didn't know, and I think that's amazing. I think there are many more who we didn't touch, not because we didn't want to, but because we didn't know they were there. And I think that's the age-old conundrum that we face. We don't know all of the possibilities that exist out in our community. And hopefully, I don't know, I think we're also energized by the connections that have been made, that I'm hoping that'll just keep fueling on each other in positive ways. But yeah, I recognize that too.
Well, I appreciate everyone who was able to present and share with us. Thank you. I think I feel a little inspired, and it sounds like the general consensus is we want to see this continue, and a lot of hope for that being the case, which is great. I did have a few updates that I wanted to share, but I'm recognizing that with time being what it is, I'd prefer to use our time with member updates. So if we have a few minutes at the end, I'll do a quick update on some bills and legislation. Otherwise, we'll put some of that in our upcoming newsletters over the next few months. But it's all mostly positive news. Some of the bills we've talked about here in this space have moved forward and are continuing to move forward, and that's really encouraging, including AB 32, which specifically relates to telehealth. But is there anyone here who had any member updates, or do some of our perhaps healthcare members want to chime in on this conversation before we wrap up? Okay, Catalina, do you want to go first, and then Mariana, you're next.
So I feel like everyone's already spoken, so that's always a great place to be, because I'm like ditto to what everyone said. But, you know, I think for us, what was really exciting was just the idea that we were able to partner with our healthcare partners in the county in such a different way. I think we're all used to looking at partnership through a different lens, and this opened up a new avenue for us. So because we did the tiered system and the rollouts, for example, it presented this unique opportunity for us to work with our K through 12 community to focus on teachers. And then to, you know, once we had already established that relationship with all of our K through 12, you know, areas here in Diablo, we were then able to roll over, and now we're doing with Contra Costa County partnering to try to do teens, right? So I think these partnerships are continuing to be strengthened, and I think that's a true testament to that. We're still partnering with the county on smaller vac sites and really targeting, you know, equity and communities of color, and thinking about getting our physicians out there to speak. You know, we did the ad campaigns early on that many of you have seen on TV. They weren't targeted, they weren't actually branded as Kaiser, and we did that on purpose because, again, we wanted these things to be something all of our partners could use. And we're doing the same thing with Get Vaccinated Contra Costa, you know, so we want to thank the county and John Muir for being really great partners on that, trying to get that through that last finish line line and get to people who really still have some questions and are, concerned about how to move forward. So just want to thank all of you. And, I know Rebecca mentioned we were really early on trying to figure out like, how do we duplicate these things? So at Kaiser, we did a bunch of playbooks and used the models of the things that we're doing in Contra Costa all over Northern California. And quite honestly, everywhere that Kaiser Permanente has a footprint. So we're really proud of the work that we did here. So thanks, guys.
Yeah, I just want to jump in and echo your comments, Carolina, and just again thank Kaiser and John Muir for helping with the school community. That was gigantic. I recall being on so many calls with the area superintendents, and you could hear the desperation in their voices about who's going to help us solve this. And if it weren't for your organization stepping up, we'd still be in this dilemma. So thank you very much. And I just want to just remind folks that we're still seeing very high case rates amongst unvaccinated individuals. And it's night and day difference. We have something close to a 8.5% to 9% per 100,000 case rate for unvaccinated individuals and well under a 1% case rate per 100,000 for vaccinated, which are kind of those breakthrough cases. And most of those are folks that only have one dose in them. So the vaccine is very, very protective. So thank you.
Those are good stats to have and know. Mariana, I want to touch on you before we start to conclude.
Yeah, just briefly, and sorry I don't have my camera on, I'm having internet issues today. So I mentioned in my introduction that I'm the chair of the Measure X Community Advisory Board. Most of you probably know, but Measure X is a half-cent sales tax. This coming fiscal year, it'll bring in about $112 million. I mean, we will have $112 million that the board will allocate Board of Supervisors based in part on recommendations from the Community Advisory Board. And I'm mentioning all this because tonight at 5 o'clock on Zoom, and we'll just put this link in the chat, we're going to focus on healthcare as our issue deep dive. We have a presentation from a panel of speakers, including 2 physicians with the county, the Community Clinic Consortium, and some community advocates and residents who have lived experience with the county and community-based healthcare system. So we're just really strongly encouraging, like, these are our dollars, our community, all of us benefit when, we all do well with our health collectively. So really encouraging folks to join. I just put the link in the chat. Starts at 5 o'clock. It's on Zoom, and we hope you'll join us and spread the word. Thank you.
Thank you, Mariana. I really appreciate you being here and chiming in with that information. I did want to mention we're doing a lot of work with Measure X and thinking about Measure X and the Contra Costa Economic Partnership side of our shop. But if anyone has any questions about that, happy to talk offline and to dive a little deeper about some of Contra Costa Economic Partnership's thoughts around that, which we'll probably be talking about with the East Bay Leadership Council as well. Bob, I just want to kind of hand it over to you really quick to kind of wrap up our meeting. I don't see anyone else with their hand raised, but did you have any updates or any information you wanted to share with the group?
I just want to thank everybody for participating today. When we transitioned from individually task force to this collaboration under the opportunity moniker, I had no idea what extensive commitment we had from various sectors of our community. And I just want to thank everybody for participating. Thanks, Lindy. No additional.
Okay, well, thanks so much, Bob, and thank you all for joining us. I did want to just say, as I mentioned a moment ago, AB 32 is continuing to move forward. That is a telehealth bill that we talked about here. We also had talked in the last few months a little bit about 1456. This is a bill that relates to Cal Grant. It's pretty specific around student aid, but it's a pretty large shift and change to that system. And we are seeing that bill move forward, but we're also seeing a lot of funds allocated towards that effort within the budget, specifically the legislators' budget that they put forward to negotiate with the governor. So we're continuing to monitor that, but I just wanted to touch on those 2 pieces of legislation as they're pretty large and important changes, and they're things that we've talked about here in this space. There are a handful of other bills that EBLC is, of course, monitoring. We'll continue to update all of you through our newsletter and other communications about that. If anyone has any specific questions about Measure X, our chair is here and with us, and she's a great person to talk to, but I'm also happy to answer any questions. Please feel free to email me to touch base about that. And with that, I think we're probably fair to conclude. Thank you all so much for joining us, and I look forward to seeing you in September, potentially in person.
Great. Thanks, everybody.
Sounds great. Make sure all your family's vaccinated.